1 out of every 2 men and 1 out of every 3 women will be diagnosed with cancer. But despite those huge numbers, most individuals don't know what that really means.
As the second leading cause of death globally, cancer continues to be the most fearful disease ever. An era of substantial therapeutic advancement and treatment, such as surgery, chemotherapy, radiotherapy, and hormone therapy. Yet no perfect cure has been found for cancer in the medical world. Should we still hope for a better way to deal with cancer or give up the fight? In this video, I present to you the first and best research-based and evidence-informed way of winning the battle against cancer. The word cancer brings to the mind proliferation and invasion of abnormal body cells. The body is naturally made up of normal cells that grow, divide or reproduce and die. On the other hand, abnormal or cancerous cells grow, divide and live longer than the normal cells, or even refuse to die and continue producing more abnormal or cancerous cells. These abnormal cells then form cancerous tumors, with few exceptions as in the case of leukemia. What makes the situation more dangerous is that these cancerous cells in turn replace the normal cells at its original position, as well as invading other areas of the body, such as liver, bone, lung, and even the brain. As in the case of advanced stage breast cancer, aside skin cancer, lung, colon, prostate, breast, and cervical cancers are the most common and prominent in terms of mortality. The burden of cancer cuts across all phases of life. And as already indicated, cancer is the second leading cause of death globally. Just in 2020 alone, cancer accounted for nearly 10 million deaths. It is estimated that between 2020 and 2050, cancer will cost the world over $25.2 trillion. But the good news is that cancer is treatable and somehow curable. Notwithstanding, the cost and sophisticated processes involved have their own unique challenges. Hence, the need for a better, reliable, and affordable treatment option. And this is how Dr. Alberto Gonzalez put it. We do recognize that in the past 30 years, substantial therapeutic advancements have been made, as well as implementation of a treatment or the combination of several, according to each individual pathology, and have been able to extend the benefit of a cure to a large number of patients. Notwithstanding, once more, we stand behind the opinion of supporters of prevention as the best strategy to avoid suffering these conditions. So we can see that prevention, such as the 4 general rule for cancer prevention, is the most assured way to victory in the battle against cancer. Do not consume alcohol or tobacco, reduce fat intake, avoid or reduce the intake of smoked, cured or salt-soaked foods, and systematically and principally incorporate fruit, whole grain cereals, and vegetables containing carotene. But it is one thing to know what to do and another thing to know how and when to do it. According to the World Health Organization, between 30 and 50% of cancers can currently be prevented by avoiding risk factors and implementing existing evidence-based prevention strategies. The cancer burden can also be reduced through early detection of cancer and appropriate treatment and care of patients who develop cancer. Many cancers have a high chance of cure if diagnosed early and treated appropriately. So you can see that early or late diagnosis, that is time in the actual sense, is an important factor in the fight against cancer. This then brings us to the main subject for this video, the best time to avoid or prevent cancer. According to Dr. Scott Owusu, even though the majority of people fear cancer, few are aware that their individual risk of having certain cancers varies after each decade of life. So you can see that your age is somehow a risk factor for contracting a particular type of cancer. Dr. Scott continues to outline the various decades of life and the associated cancer risks as follows. Between 20 to 30 years, testicular cancer for men and cervical cancer for women. 30 to 40 years, testicular cancer and lymphoma for men, cervical cancer and lymphoma for women. 40 to 50 years, there is a high risk of lymphoma, colon and prostate, and lymphoma and breast cancer. 50 to 60 years. In fact, this is a danger zone for prominent cancers among men and women. There is colon, prostate for men, likewise breast, colon, and lung cancer for women. 60 to 70 years, the risk of colon, prostate, lung exists for the men, and also leukemia. Likewise, the risk of breast, colon, and lung cancer for women, and ovarian cancer. The last range is 70 years and above. The risk of colon, prostate, lung, breast, leukemia, and ovarian cancer. Other cancers such as bladder, throat, esophageal, kidney, pancreatic also pose a high risk. So now that we know that you may be at risk for some cancers almost at any age in life, what will be your conclusion on the best time to avoid or prevent cancer? For me, the best time to prevent or avoid cancer, that is the best time to implement the general rules for cancer prevention, is now. I mean right now. Moment by moment, one day at a time. We should give no chance for procrastination. Procrastinating the urge to implement the preventive measures until you reach a particular decade of life may be too late for you to prevent the cancer that you fear. In our next video, we will be dealing with some simple home recipes for some cancers. I am very grateful for your time. Don't forget to like this video and also subscribe. Bye bye.